Hi everyone, welcome once again. In today's video, we'll be looking at implementation, which is one of the stations in OSCE. It is a talking station and it is 15 minutes. So I've got this scenario here and I'm going to read it out before we go through the scenario together. Alison Sander is being treated for exacerbation of asthma. You have 15 minutes to complete this station, including all the required documentation. Complete all sections of the document and assume it is today and it is 1400. So this medication is for 1400. So I'm going to start. However, when I'm reading my chart, it is essential that on the first page, you read out all your patient information on the first page. Whereas the subsequent ones, you can just read out the patient's full name and the date of birth, or the patient's full name and hospital number. Okay? So I check for scene safety. I can see my scene is safe for me to approach. I draw the curtain and I close the window to maintain my patient privacy and dignity. I go ahead to perform hand hygiene, following the 7-step technique of WHO for hand hygiene. I put an ampoule of gel in my hand and I rub palm to palm to the back of my hands and vice versa. Fingers interlocked, vice versa. Fingers interlaced with palm to palm. My fingertips in rotational manner and vice versa. My thumb in rotational manner and vice versa. My wrist in rotational manner and vice versa. And I allow my hands to air dry for 30 seconds. Now I'm happy to approach my patient. Hello, good morning.
Good morning, nurse.
My name is Funke. I'm one of the nurses that will be attending to you today. And I'm here to give you your medication that you are due for at 1400. Is that okay by you?
Yes, nurse.
All right. So I want to assure you that I'll be following the 7 rights of drug administration as I administer this medication, and I've got the BNF here as well. It's just for me to look into those medications that I'm not quite familiar with, to look out for their indication and their side effects. Is that okay?
Yes, nurse.
All right. So can I please know your full name and your date of birth as I cross-check with the document in my hand as well as your wristband?
My name is Alison Sanders and I was born on the 1st of 8th, 1993.
Beautiful. And how do you want me to address you, please?
Alison, please.
All right. And I can see that your hospital number is 0976 6521. Alison, have you got any allergy?
Yes, nurse. I'm allergic to penicillin and peanuts.
Oh, and if I may ask, if you take penicillin, what happens?
I do have anaphylaxis.
And what about peanuts?
I vomit.
Oh, so sorry to hear about that. But I want to assure you that I will not give you anything that contains penicillin, no peanuts, when you are under our care. And I can see you have a red wristband and it's well documented on it. That's beautiful. Okay, Alison, are you in pain at all?
No, nurse.
Okay, so I'm going to be reading out your mark chart with you. Is that okay?
Yes, nurse. I
can confirm I have the chart for Alison Sanders, date of birth 1/8/1993, hospital number 09766521. The ward is respiratory ward. Date of admission is today. Height is 1.56. Weight is 55 kg. Consultant is Dr. Bullard. Time of admission is 800. And the prescriber name is A. Bullard with GMC number 654923. The signature is A. Bullard with blip 6853. The allergy is well documented. I'm moving to the next page. I can still confirm I have the mark chart for Sanders Allison. Date of birth 1/8/1993. The code for drug not administered is documented. On one's only medicine, the date is today. Drug is paracetamol. The dose is 1 gram. The route is intravenous. Instruction is for pain. The time required is 800. Prescriber signature is A. Bullard with blip 6853. Time given is 1100 and signature of the person that gave is there. Date is today. Drug is under citron. The dose is 4 mg. Route is intravenous. Instruction is for nausea. The time required is 800. Prescriber signature is A. Bullard with blip number 6853 and time given is 1100. Signature is also documented. Moving to the next page, I can still confirm I have the chart for Alison Sander. Date of birth 1/8/1993. On prescribed oxygen, Alison is not a non-CO2 retainer and the target oxygen saturation is 94 to 98%. Assessor, could I please confirm my patient's oxygen saturation is 98%? Oh, okay, thank you. All right, so I move on to the next page, and I can still confirm I have the chart for Alison Sanders with date of birth 1/8/1993. On antimicrobials, the first drug is amoxicillin. The date is today. The dose is 500 milligram. Frequency is 3 times daily. The route is per oral. The duration is 7 days, and the start date is today. The indication is for anaphylaxis to possible chest infection, and the finish date is plus 7 days. Culture was sent. Prescriber signature is Allotted with blip 6853. It was given at 800. It was due at 800, but you were away from the ward, and it's due at my time, which is 1400 as well. This is a valid and eligible prescription. However, Alison, I will not be giving you this medication because you are allergic to penicillin, and amoxicillin and penicillin, they are both in the same class of penicillins. But I'm going to be escalating this to the medical team so that they can prescribe another antimicrobial that you are not allergic to. Is that okay?
Yes, ma'am.
All right, so I move to the next page, and I can still confirm that I have the MAR chart for Alison Sanders, date of birth 1/8/1993, on regular medicines. The first drug is levothyroxine sodium. The date is today. The dose is 100 microgram. Frequency is daily. Route is per oral. Duration is continuous. Start date is today, and finish date is continuous. The instruction is for hypoactive thyroid. Prescriber signature is Allotted with blip 6853, and this is due at 1400. It is due at my time. This is a valid and eligible prescription. Alison, levothyroxine sodium, like I've said earlier, is used for hypoactive thyroid, and one of the side effects that you can have is you could have vomiting or slight headache, and you may not even experience any of these side effects. Is that okay?
Yes.
All right, so moving to the next medication, the drug is prednisolone. The date is today. The dose is 40 milligram. The frequency is daily. The route is per oral, and the duration is 7 days. The start date is today. It is for exacerbation of asthma. Finish date is plus 7 days. Prescriber signature and blip is Allotted with blip 6853, and this is also due at my time, which is 1400. This is a valid and eligible prescription as well. Prednisolone is a corticosteroid, and it is used for exacerbation of asthma. One of the side effects that you can have is muscle cramps. You may not even experience any, Alison. Is that okay by you?
Yes, ma'am.
All right. So I'm going to be putting a dot on this medication. So I'm just putting a dot. I'm not signing this medication. So I move on to the next page, and I can still confirm I have the MAR chart for Alison Sanders, date of birth 1/8/1993. On as required medicines, the drug is paracetamol. The date is today. The dose is 1 gram. The frequency is every 6 hours. The route is per oral. The duration is continuing, and the start date is today. The instruction is for headache and migraine, and the finish date is continuing. Prescriber signature is Allotted with blip 6853. Alison, are you in pain at all?
No, no.
All right, thank you. However, even if you were in pain, I wouldn't have been able to give this paracetamol because you had it about 3 hours ago. I will have escalated this to the medical team to prescribe another analgesic for you. All right, moving to the next page, I can still confirm I have the chart for Alison Sanders, date of birth 1/8/1993. On infusion, there is no infusion prescribed. So that is all I have for you, Alison. I'm just going to step aside now to go and get your medication. Just give me a shout if you need anything. So I perform my hand hygiene, following the 7-step technique of WHO for hand hygiene. Assessor, could you please confirm that this drawer cupboard is under lock and key and is safe for me to use?
Yes.
All right, so I'm going to get my medications ready. All right, so this is levothyroxine. It comes in 100 micrograms and is expiring 10/2/2025. It's been 100 microgram has been prescribed, so I'm going to be taking 1 tablet. So I put 1 tablet on the cover of this medication pot, and I drop it in the medication pot. Okay, So I close the back and I put it aside. I take another medication pot, and this is prednisolone. It comes in 5 milligram per tablet, and it's expiring 6/4/2024. And let me check how many milligram was prescribed for Allison. Allison is to have 40 milligram, meaning I'm going to be taking 8 tablets of prednisolone. So I take 8 tablets of prednisolone, I put it on the cover of the medication container, and I pour it in a different medication pot. All right, so I put this aside as well, and then I'll be going back to Allison now. Hi Allison, I'm back. Are you okay?
Yes, nurse.
All right, so I've got your medications ready in 2 separate medication pots. And before you take your medication, can you please confirm your full name and date of birth for me as I cross-check with the documents in my hand, as well as your wristband, please?
My name is Allison Sanders, and I was born on the 1st of August 1993.
All right, thank you, Allison. Allison, when I asked you earlier, you told me you were allergic to some things. Can you tell me what are those things you're allergic to again?
Penicillin and peanuts.
Oh yeah, now I know, you said that earlier as well. I can confirm I don't have anything that contains penicillin here, and there's nothing that contains peanuts here as well. Allison, are you in pain at all?
No, nurse.
All right, that's lovely. And it's good that you are sat up already. Do you want your water first, or you want your tablet first?
Can I have my water first?
All right, here you go, Allison. I've got your water here, okay? And then your tablet, do you want them together or one after the other?
One after the other.
All right, so you take this first, water given. Take this tablet first, okay? All right, and the second tablet, okay. Have you swallowed it all, Allison?
Yes, nurse.
All right, that's fine. So, Allison, I'll be coming back in the next 30 minutes to come and reassess you for the side effects and effectiveness of this medication. Is that okay?
Yes.
All right, so I'm going to be stepping aside now. I just need to document on my chart. Is that okay?
Yes, nurse.
All right, so I'm going to be writing my name on the details of person administering medication. So I put my name, and then I put my initials and my signature, and the base is respiratory ward. Okay, so I'm going to be putting my signature and the date in front of levothyroxine. Okay, so I put my signature, and then I put the date as well. And for prednisolone for 1400, I put my signature and I put the date as well. And for amoxicillin, I'm going to be coding amoxicillin a code of 10. So I put 10, I circle it, I put my signature, and I put the date as well. And at the back of the MAR chart, I'm going to be writing on the omitted doses of medicine coded 10. So because I've coded amoxicillin 10, the date is today. I put the date. The drug is amoxicillin. The dose is 500 milligram. The route is per hour, and the instruction is for prophylaxis for chest infection. The time given is 1400, and the reason for omission is Allison is allergic to penicillin. My signature, I put that as well. And I'm just going to go through my charts just to be sure that I haven't omitted anything that I shouldn't. All right, so I'm just going through my charts. I can see that all my I's have been dotted and I've crossed all my T's. Yes, so I'm absolutely fine with that. Allison, I'm done. And thank you so much for your cooperation. Like I said, I'll be back in the next 30 minutes to assess you for the side effect and effectiveness of the medication. But if you need anything, here is the call bell. Do always press the call bell and somebody will be here to attend to you. Is that okay?
Yes.
All right. So I ensure that I make my patient environment safe and clean for next use. And I'm going to be performing my last hand hygiene following the 7-step technique of WHO for hand hygiene. I put an ampoule of gel in my hand. Thank you so much for watching. I'll see you some other time. Bye for now.